Everyone. My name is Parth Chowatia. I'm a sports physiotherapist by profession, and I've been in this field for the last 9 years. I have my own space in south of Bombay. It's called Apex Physio, and I've been working with my clinic for the last 1 year. So I see patients anywhere between a sports background and someone just coming from a MSK or a simple background. So it can be anyone from the age of 14 or 10 or going up to the age of 80, 85. We're sharing a case which is very interesting, which will basically highlight the important points and important aspects of having a dynamometer, what Fitmust gives. So I had a 65-year-old runner who came into the clinic, and she had bilateral hip pain, and it turned out to be bursitis on both sides. On checking the strength of the hip abduction and hip flexion were two important factors, or I would say parameters, which were really low comparing to the normative data also, and her for being a runner, it was very low. And I checked it, and I think I saw her in June this year, and I found when we did the test, the basically the parameters were very low as compared to the normative data. And when she came back in September, obviously this was after a very a lot of exercises were done meanwhile from June, July, August, and September. And when she came back in September and we checked the same strength, so we did hip abduction and hip flexion again, and we saw a significant amount of improvement. Obviously, what you do in terms of exercises is very important. But if you see, if I didn't record this when she had come in June, I would have not seen, or I would have not been able to measure the improvement that I've seen in this case. So that's why I feel having a device such as Fitmust is very important, and I found it very helpful. And this is just one case that I'm talking about, but there are, I would say, hundreds of cases that I see, and on which I've done this, and it has helped me really well in my practice as well. Yeah, I think that's all from my side. Thank you so much.